CDC guidance is now official. Pregnant women should get the COVID vaccine. The government health agency updated its advice yesterday after it found no increased risk of miscarriage among those who have been immunized.
And there is a lot of work to do getting pregnant women vaccinated. Just 23% of pregnant women have received at least one dose of the vaccine. I sat down with a local mom-to-be today who just had her first shot.
You are 38 weeks pregnant today.
Yes. Anna Karabacha Vest, a local attorney, got married and pregnant during the pandemic. Baby Oliver will be her first child. She has a lot of nerves becoming a mom for the first time, especially in a world filled with uncertainty due to COVID. She debated for months whether to get vaccinated.
And I was just very hesitant about it because it just felt like the first decision as a mom. It felt like the first time I did not think of myself. It was about what's the best for the child.
She discussed it extensively with her OBGYN, Dr. Stacy McHale, who is also president of Clark County Medical Society.
I've been encouraging vaccinations for all of my pregnant patients since March, when they were available through the tiers for the Nevada rollout for vaccines. The vaccine hesitancy for pregnant women is very understandable.
So Dr. McHale went over a lot of the ACOG guidelines with me because at the time when I was going through the decision to get the vaccine, the CDC recommendations had not come out yet.
Anna finally decided to get the first dose of the COVID vaccine just 2 weeks ago. Her second vaccine is scheduled for August 18th. Her due date, August 27th. She says the rise of cases with the Delta variant was a big motivator, hearing stories of other new moms now in the hospital.
Maybe, I can't see the baby right away. If I do something like that, those sort of stories really did scare me.
We have pregnant women who are on ventilators in ICUs across our valley, not just here, nationwide, we're seeing the same thing. And it's really devastating for OBGYNs to know that this is something that could be prevented.
Dr. McHale says it's been an uphill battle, but about 60 to 70% of her patients are now vaccinated. She says the CDC has been following 135,000 vaccinated pregnant women since pregnant healthcare workers were first vaccinated back in December. And the science shows it's the safest decision for both mom and baby.
Women who are diagnosed with COVID in pregnancy have a higher chance of hospitalization, requirement for supplemental oxygen, ICU admission, mechanical ventilation, and death.
Anna feels like a weight has been lifted off of her shoulders, finally making the decision to get vaccinated, and feels validated by the CDC's new guidance.
This is science, and it's wonderful that we've gotten this far and we can do this to protect the society and ourselves and our babies.
And Dr. McHale also suggests that pregnant women wear a mask whenever they go out. She also wants to dispel myths about infertility, saying there is no evidence that any vaccines, including COVID-19 vaccine, influences your chances of getting pregnant.